Today's webinar will cover the HealthCare.gov auto-renewal process for 2021, including the process to plan enrollment and redetermination of premium tax credit eligibility. Today's presenter here at the Center on Budget and Policy Priorities is Tara Straub, Senior Policy Analyst. Turn it over to you, Tara.
Thank you, Ina. Today, like Ina said, we're going to talk about auto-renewal, which is on people's minds now because people are starting to get letters reminding them that they need to renew their policies and what their options are. So as you all know, open enrollment starts November 1st. It's burned into your brains. I know it's 45 days for people in HealthCare.gov, but state-based marketplaces can extend their enrollment, and you can see that many have. Some states even have in statute that they have a longer open enrollment period, or regulations at least. And you can see that we've added a couple new states. Welcome to the state-based marketplace world, New Jersey and Pennsylvania. So the first thing, obviously, is that we want to encourage active re-enrollment. And there are a lot of reasons for consumers who are already enrolled to return to the marketplace. Obviously, the biggest reason is that people can get the most accurate eligibility determination if they come back and update their income, household size, and their employer insurance offer. This is going to be especially true this year, because remember that the income projections that people make for 2021 might be significantly different than 2019 income in the data hub, which is what it's compared to. So if people come in and they have had income that is, well, if people fail to come in to the marketplace, but they were enrolled in 2020 and they're going to be auto re-enrolled, their 2020 projection may be very different than their expected income for 2021 unless they've gone in to change it. So there are lots of reasons to come back in, and we want people to receive the correct amount of financial assistance so they can avoid getting too little help and avoid repaying at reconciliation. So finding that sweet spot where people get the right eligibility determination. And also more people this year may be eligible for Medicaid. And so we want people to update their income if their income is substantially lower. Also, of course, there might be new health plan options. Several states have new insurers or new plans coming into their networks. There can also be changes to premiums, to provider networks, to out-of-pocket costs. And in 2019, consumers who actively re-enrolled paid 38% less per month than those who came through auto re-enrollment. And so there's a big benefit to coming in and shopping. And remember, of course, switching plans outside of open enrollment is restricted and it requires a special enrollment period. So people need to come in now. All right, having said all of that, we're going to talk about what happens when people don't come in. And it's still, okay, so why do we want to tell you about people who don't come to see you? Well, it's because people may come to see you after they start getting these letters, after they start through the process, after they get notices from their insurers. At some point along in that process, they may come to see you. And of course, after December 15th, when they start getting notices saying, congratulations, you're enrolled in this plan, they may come to see you then to say, what on earth? I didn't do anything. How did I get enrolled in a health plan? So it's important to understand the process and to understand the notices that people are getting and the timing of some of the notices. So first, we're going to talk about redetermination of APTC. There are really two steps here. First is redetermination of eligibility and the amount of financial help. And then second is automatic enrollment into a plan. And you really have to think about them as distinct processes because remember that people can have their financial eligibility terminated while still being automatically enrolled in a plan. And that can be a difficult situation for families if they were relying on that financial assistance, and then all of a sudden, after December 15th, they get a letter that says, an eligibility determination notice that says, hey, you're still enrolled in a plan, congratulations, but you're not getting any help paying for it. So we're going to look at both of these processes separately, but they're both really important. So what does the redetermination process look like, big picture, in HealthCare.gov? So first, the health insurance marketplace for people who were enrolled in 2020 coverage will talk to the IRS electronically to find out things like income for 2019, as I said, and they'll find out about your tax reconciliation, APTC reconciliation status. So if someone is eligible to re-enroll with APTC and CSR, cost sharing reduction, and APTC advanced premium tax credit, if someone's eligible to re-enroll with APTC and CSR and they do nothing, the APTC is going to be renewed using an updated FPL and benchmark premium. And we will talk more about what that looks like. If instead the person comes and updates their information in the marketplace, they'll be renewed based on the updated information, which is going to be much more accurate. Now let's say that someone is eligible to re-enroll but without APTC. In that case, of course, they can go back to the marketplace and enter their information and maybe become eligible for APTC based on what they've entered. Or they can do nothing and they can be auto-enrolled without APTC. So the first notice that we're going to talk about, and throughout this, we're going to be talking about a lot of different notices. A lot of these are posted on marketplace. I think it's marketplace.cms.gov. If you want to take a look at these, yes, we have it at the bottom of this slide. If you want to take a look at these, it can be useful to see them ahead of when consumers see them. This is the Marketplace Open Enrollment Notice. It's called the MOEN. And the MOEN is already going out to consumers. This is a description of the redetermination and re-enrollment process that is based on the enrollee situation. So there are actually, I think, 4 different versions of this standardized letter. And it emphasizes the importance of updating the application. It talks about how APTC will be redetermined for 2021 if the enrollee doesn't contact the marketplace for certain people. And for other groups, it will include a warning that if someone doesn't take action, they'll be re-enrolled, but without APTC or CSR. But it doesn't say precisely why the enrollee is ineligible, which can be really confusing for people. The MOEN also gives important deadlines for open enrollment. And keep in mind that the MOEN is not a determination. So it's really the first step in the process and it's more informational. So let's talk about some of these groups at the MOEN and how the marketplace decides which version of this letter to send. There's just your basic vanilla standard group. These are people who authorized HealthCare.gov to pull their tax data. Their available income information shows them within the APTC range. We'll talk about some exceptions to that. And they don't fall in one of the special groups that we're going to talk about next. There's also the income-based outreach group. And these are folks who authorize HealthCare.gov to pull tax data. And one of the following applies. Either the IRS didn't provide tax data, so they authorized it, but the IRS didn't give it to the marketplace. The most recent eligibility determination or 2019 tax data show income above 350% of poverty. So, special warning to those folks that, hey, your income's kind of close to the top of the APTC range. Or 2019 tax data show income more than 50% higher or lower than the most recent eligibility determination. So, hey, your determination might be off, either higher or lower than it should be because there's a disconnect here between your tax data and your 2019 tax data and your 2020 subsidy. Or 2019 tax data show income under 100% of the poverty line. So all of these folks that fall into these 2 groups will be auto-renewed if there's no action taken, and they'll be redetermined eligible for APTC and or CSR. So So these folks are kind of in the clear, but they really need to go back and update their information. You can see some of them are kind of on the cusp, like the people who have, who are around 350% of the poverty line, because we don't want their new income to be over 400% and have to pay back APTC. But these people are going to be redetermined eligible for APTC. There are other people who are not eligible for redetermination of APTC. These are, there are 4 main groups. These are the opt-out group. These are folks that did not authorize HealthCare.gov to pull tax data. And so if the marketplace can't look up the most recent income information, then you're going to have to come back to the marketplace and make a new projection. It's people who are over income. This is also called the special notice group. And that's for people who have income above 500% of the poverty line. If your income is that high, you're not going to be eligible for redetermination of APTC. There's a repeat passive group, and these are people who've been auto-renewed in the past 2 years, haven't come back to the marketplace, and there's no IRS income information. So these people have been MIA for a while, so they're going to need to come back in order to get APTC. And finally, there's the failure to reconcile group, and that's commonly called FTR. These are folks who received APTC in 2019, but they didn't reconcile their APTC. And so they're not eligible until they file a tax return and attest in the application to reconciling the 2019 APTC. So you know that they will get a question in the application that says, did you reconcile your APTC for 2019? And so when the time comes, they'll need to go in and say yes to that, assuming they have actually taken the step to file their taxes and reconcile. They're going to get a paper, they're going to get 2 warnings. They're going to get one that is kind of general, and then they're going to get one that is specific to them. But all of these groups, these 4 groups, are going to be automatically re-enrolled, so they can get a plan, but they can't get APTC. So they really need to come in if they want to continue to get financial assistance. They said the FTR group, you get a warning. This is sent to people who enrolled in 2019, who are also still enrolled in 2020, and who did not file a tax return and reconcile for 2019 APTC. There's a person-specific option, unlike the MOEN. You can see that the letter that we have there is dated. Usually, that's the most recent one that they had it at marketplace.cms.gov when we looked a couple days ago. And usually it means that the text hasn't changed. So you can still consider that letter to be current, even though the dates are wrong. So people will have to test a filing before they can receive financial assistance. And this notice is going to be paper only, so they're not going to see it in their account. A quick note on a group that's not eligible for auto-renewal. This is people who are a member of an enrollment group that has someone with Medicare coverage. So if an insurer learns that someone is entitled to Medicare Part A or is enrolled in Medicare Part B, the insurer has to terminate coverage for all enrollees on December 31st. And that means that anyone who shares a policy with someone who's enrolled in Medicare won't have their coverage renewed for 2021, even if they're eligible. And so that those individuals in the family who are not enrolled in Medicare need to return to the marketplace. They need to re-enroll in coverage. And there's also a special enrollment period available if the open enrollment has ended for people to re-enroll in coverage. And when this applies, people will get several notices. They'll get a notice from the insurer about non-renewal and termination, and they'll get a notice from the marketplace urging people to come into open enrollment or during a SEP, a special enrollment period. So the result, if no one comes back in, is that the coverage for the whole group will not be renewed for 2021. So let's talk math briefly. This is what redetermination looks like for APTC and CSR. There are certain data points that we're looking at. One is the updated federal poverty guidelines. And of course, remember that we use the 20 poverty guidelines, not 2021 because we don't have 2021 yet. So we're always a year behind in the poverty guidelines we use. The 2021 benchmark plan premium, the most recent income information available adjusted to 2021. So we are keeping the FPL level constant. And the income information that they're going to be adjusting, the first option is to adjust the 2020 projected income. The second option is to adjust the 2019 tax data. So if they don't have 2020 projected income, then they're going to go to the tax data. If the projected 2019, and then the final option is the projected 2019 income. And this is going to be really rare. It's only if the 2019 tax data indicate income below 100% of poverty. So this is the order in which the marketplace will decide which income that we're updating to get the 2021 APTC correct. And I have notes here to remember the COVID impact. So the 2021 projected income may be way off because no one had pandemic in their cards for 2020. So the 2020 projected income may really not reflect what people are expecting for 2021. So it's especially important for people to come in and update their application. And the same, as I said earlier, is true with 2019 tax data. 2019 was a very different year than 2021 might be for many people, especially the people you see enrolling in the marketplace. It's a lot of lower income people, a lot of people who have multiple jobs, who have part-time jobs, who may have lost work, who may be in industries like the service industry where they're not offered coverage at work. And so they've really been buffeted around by COVID. So there's an especially big impact, I think, with the population that you're serving. So let's look at a couple quick examples, and we'll try to make the math a little easy and quick. But Katie updated her application during last year's open enrollment to update her income information and to re-enroll in 2020 coverage. Now let's say Katie does not go in and update her income for 2021. So the marketplace is going to use that first option. It has 2020 projected income, and so it's going to adjust that. So if her income in 2020, her projected income was 150% of the poverty line, then they're going to bump that up. So it's still 150% of the poverty line. So they'll just apply the new FPL and get her new adjusted income. On the other hand, let's say that Sasha was enrolled in 2019, but she auto-renewed for 2020. So the marketplace doesn't have a 2020 projected income, so they go down to the next tier. The next option is using 2019 tax data, and so that's what they do for Sasha. The marketplace will use 2019 tax data for the most recent income to be adjusted, and so if her income, if her 2019 tax data indicate that she was at 265% of poverty, they will bump that up so she is still at 265% of poverty. But of course, her income is going to be higher because the FPL is higher. One quick example with marketplace numbers. So again, we're going to go back to Katie, and she has household income of 150% of the poverty line in 2019. I'm sorry, that should be 2020. And she has the cost, her benchmark cost is $4,000. Her income meant that she was paying 4.12% of income based on, that was her expected contribution. And so you do the math there and you can see that she will pay $269 a month, or sorry, she will get a premium tax credit of $269 a month. Now, if she is redetermined for APTC in 2021, the marketplace, remember, is going to adjust her household income unless she comes in and adjusts it herself. And so here are the variables that will change. The variables in red will change. So the cost of a benchmark plan changes. It's $200 higher than it happened to be in 2020. The expected contribution is going to go up just a tick from 4.12% to 4.14% of income. And if you do the math, that means that her premium tax credit is going to be a little higher. So her premium tax credit will be $284 a month. So that was all what happens on the APTC side. And so now we're going to talk about the second part of that process, which is auto-enrollment in a plan. So there are a lot of notices that people will get about auto-enrollment into a plan, and about when they've selected a plan. So one of the notices they'll get is a notice from the insurer. And the insurer notice will give them the availability of their current plan, whether it's still going to be offered. It will talk about key changes to benefits and cost sharing. If the current plan is not available, though, there are two scenarios that could happen. One is that they'll offer another plan through the same insurer, and the person will be auto-enrolled into that plan instead. And so this notice will provide information on the new plan. So they'll have the discontinuation of the current plan and details on picking a new plan. If there are no plans available through the same insurer, then this notice will lay out the discontinuation of the current plan and how to pick a new plan. And the marketplace might automatically enroll the person in a different plan through a different insurer. And we'll talk about that in just a minute. The notice will also go over premiums for the current or the new plan. The estimated premium amount takes into account the monthly APTC. So people will see what their subsidy is and see the premium post-subsidy. But this is really important. The APTC in the notice could either reflect the current APTC the enrollee is receiving or the redetermined APTC. So the actual APTC for 2021 might be higher or lower depending on income and the change in the cost of benchmark plans. But it may not be entirely obvious whether you're looking at the current APTC or the redetermined APTC, and to the extent that those things are different, people may be surprised. Now, I think that in many cases they use the current APTC, so you know already it's going to be off. And then they'll have information about other coverage options that are available in the marketplace. If someone doesn't take action by December 15th, the end of open enrollment, a person's going to be auto-enrolled in a plan for 2021. The subsidies will be adjusted according to the process that we talked about before with APTC eligibility, or the subsidies might be discontinued. And as I mentioned earlier, there's a hierarchy for auto-enrollment. The first option is going into the same plan. The second is, if the same plan isn't available, going into a new plan with the same insurer. And the third option is, if there are no plans available from the same insurer, going into a new plan with a different insurer that is as similar as possible to the current plan. So first, when people are auto-enrolled into the same plan, they have to know that the premiums, benefits, and cost sharing might change. Their notice is going to outline the premium costs and changes to the plan. They can return to the marketplace, of course, and choose a different plan. And they have until December 31st. This is important. They have until December 31st to cancel coverage without incurring 2021 premiums. So if they get the notice at the end of the day that says, on December 16th, that says, hey, congratulations, you're automatically enrolled in the same plan you had for 2020, and they don't want that plan, then they can cancel coverage. Now, what they can't do is go pick a new plan, but they can't end their current plan if they want to. Then, as we said, other people will be enrolled in a new plan. And basically the notes are the same. The notice will outline premiums, benefits, cost sharing. They still have until December 31st to cancel. Except in this case, the difference here is that they're eligible for a special enrollment period due to discontinuation of the previous year's plan. So if you were enrolled on the last slide in the same plan, you didn't have this SEP. But now, if you miss the open enrollment period, you still qualify for a special enrollment period. Why? Because your plan was canceled. So even if they've put you with a new plan, that doesn't matter. You still have extra time to enroll, to choose your own plan. And so December 15th isn't a drop dead deadline for them. Other people will be enrolled in a new plan with a new insurer. And I think that this is really relatively rare. It would really happen, I think, if insurers are exiting the market, and that's not happening as much as it was a few years ago. And there are a bevy of notices for this one. So the people will get a discontinuation notice from the current insurer. They'll get a marketplace notice to let you know that all this is happening. They'll get a notice from the new insurer about the new plan and how to pay the premium. And they will have to pay a premium to effectuate coverage. Unlike if you were enrolling in the same plan, re-enrolling in the same plan, you wouldn't have to pay a binder premium, which is what it's called, but you have to pay the first month's premium if you're enrolling in a new plan. And you have until January 1st to pay, in general, to pay the first month's premium. But just like with the last slide, people are eligible for a special enrollment period due to discontinuation of a previous year's plan. The notice that we, if there's no plan available from the current issuer, the notice that you will get to be matched with a new insurer is called a cross issuer notice. And we just have a little clip from the cross issuer notice. Like some of the other clips we have, this one is a year out of date because the new one hasn't been posted to HealthCare.gov or to the CMS website yet. But it's going to include information on the next steps, including how to compare other plans and how to activate your special enrollment period. So it'll tell you about your special enrollment period if you read the notice. And a little bit more highlighting this SEP, because many people don't know that they have an SEP option. Again, if your 2020 plan is discontinued, a SEP is available, and you can switch plans up to 60 days before, or important, 60 days after the discontinuation date of your 2020 plan. And the discontinuation date is December 31st. So people who are, even if you're auto-enrolled, you still can change plans after January 1st. You're not stuck. So an example of auto-enrollment, if Katie's plan is no longer available in the marketplace, she's going to receive a couple of notices. She'll receive one from her insurer about discontinuation, and she'll receive a notice from the marketplace when she's matched with her new plan with a different insurer. When she checks her marketplace account on December 20th, she's been auto-redetermined for APTC of $301 a month. She expects to make more money, and she updates her application, and her APTC drops. She's matched with a new plan. She has to pay her first month's premium to effectuate coverage. And when she updates her application, the matched plan is going to be shown in her account during the plan selection. If she likes the plan, she can pay the premium, and coverage will begin on January 1st. But if she wants to change plans, she does have the SEP available. And so when she updates her application, she can answer the SEP question to say she's losing coverage December 31st. And then she'll have the option to change plans up to 60 days after January 1st. If she's changing plans after open enrollment but before the new coverage year, when she updates her application to change her 2021 income projection, she can pick a different plan than the one she's matched with coverage beginning January 1st. But if she's changing plans after January 1st, she is auto-enrolled, she gets the 60-day SEP, coverage will be effective the first day of the month following plan selection. If she never effectuates the renewed plan, so she doesn't pay the first month's premium, and therefore she's considered not to be auto-enrolled in the plan, she can still use her SEP, but of course she might have a gap in coverage. Some more notices that are important to know. Of course, your eligibility determination notice. This is probably the most important one folks get. Everyone gets an EDN. This is your final eligibility determination for the upcoming plan year. And it's got the plan name, the plan ID, financial assistance. It'll tell you what your next steps are. If you don't get an EDN, that means you weren't re-enrolled. So people should get EDNs, and if they don't, you've got a problem. There are, of course, multiple versions of this, depending on whether people are eligible for APTC or not, whether their family has mixed eligibility between Medicaid and APTC, and CHIP, or whether they're just flat out assessed eligible for Medicaid. People will also get an enrollment confirmation message. And this is going to be just for folks who have not made an active plan selection. Whereas remember, the EDN, it goes to everyone. And this is the eligibility determination for the coming plan year. It'll confirm the plan name. So it has some of the information that was also in the EDN. And again, there are multiple versions of this depending on whether you were depending on whether you went to another insurer, you were enrolled without financial assistance, or you were enrolled but you need to submit some documents. And canceling coverage, this is still really important. Unfortunately, this is a dated screenshot, so it may have changed a little bit, but not too much. Enrollees have until December 31st to cancel their 2021 coverage without incurring any premium costs for 2021. And so if someone is enrolled in 2020 coverage and they don't want to be auto re-enrolled, they need to come in and cancel their plan. And of course, a lot of people don't know that. You know, if you're enrolled now, you know your plan stretches to December 31st. And you take no action, a lot of people will just assume, well, if I don't do anything, then the plan's going to stop because it says it's going to stop December 31st, which is a totally reasonable assumption, except we have this policy of auto re-enrollment, which is super important for a lot of people. So if people want to stop coverage, they actually have to go into their application and say they want to stop coverage. And if coverage isn't stopped, they could find themselves on the hook for a January premium. And that's because if they are auto re-enrolled, even if they don't want to be, then they, you know, let's say they don't pay a premium because they don't know or don't want coverage. They go into like a grace period potentially, depending on whether they're enrolled in the same or different plan. Coverage is lost with the effective date of the last day of the first month of coverage. So they might end up on the hook for a month of premium if they don't actively stop their coverage. Some tips for assisters. It's really important to emphasize updating information and shopping for plans. And of course, if someone is knocking at your door, they probably already get that. The good news is that upwards of 60, close to 2/3 of folks who are enrolled go into re-enroll, which is to do active re-enrollment, which is great, but it always helps to have more do that. It helps people more accurately project the 2021 income. If you need some help, you know, you can compare 2019. Like I said, 2019 income may be very different, but you can look at 2020 and see what kind of, you know, turbulence they had in their year and have a serious discussion about what 2021 might look like. And of course, you know, we're all crystal balling it. We're going to need to tell people that that they're likely going to have to, you know, come back and update their application through the year because, you know, a lot of folks just don't know what the year is going to look like. In 2020, almost 80% of people shopping in the marketplace had access to a plan for under $75 a month. And so that's a really powerful incentive for people to come in and shop. You can also remind people that they only have until December 15th to change plans in many cases, unless they are eligible for that step. And of course, we know that deadlines really help folks. They really drive a lot of enrollment, emphasizing deadlines. Look out for people who are eligible for cost sharing reductions, who are auto-renewed or auto-enrolled into a non-silver plan. And again, some people may be eligible for steps. Educate consumers who received APTC in past years about the need to file a tax return and reconcile their APTC. So people will need to file that 2019 tax return in order to get APTC for 2021. And then once they file that tax return, they'll need to go back into the application and let the marketplace know that they filed their tax return. And then, of course, as we said, remind people to cancel their plan if they don't want to re-enroll. We've got some resources here. We're highlighting the resources from the marketplace, and you might ask, why do we have guidance for coverage years going back to 2017? We actually could have gone back to 2016 and it would have been productive. And that's because for the most part, the marketplace guidance has stayed the same on their process on re-enrollment with a couple of exceptions. So those are still useful documents, even though they seem dated. And again, it's really helpful to read the notices in advance just to have an idea of what they're saying, and those are available online. And as I said, if you see an older notice, it is probably has not been updated because the language hasn't been updated. So still worth your while to look at. And with that, we can take some questions.
Great, thanks, Tara. So we do have a couple of questions that came in. The first question is, when the marketplace auto-renews a consumer, do they check with the IRS to see if their income has changed?
So that depends. So if they're, I mean, this goes back to the initial check that they do to determine which MOEN to send, and whether people, whether in that check they find out that people are in certain groups that make them ineligible for APTC. So for instance, if the marketplace does that check for everyone who's enrolled in 2020 coverage and finds out that their income is over, that their tax data indicate that their income is over 500% of poverty, then they'll get a different kind of notice than if their income is within APTC range. And so yes, there's that check with the IRS, and it determines your pathway and whether you would be auto re-enrolled with APTC or without APTC.
Great. In the example where someone is auto-enrolled into the same plan and cancel in January, they still owe that 1 month of premium. What happens if they don't pay for that 1 month?
Well, if they end up owing a month of premiums just because they didn't cancel, so what happens with that month? Well, a couple of different things could happen for that month. So if they do pay their premium, but maybe they're grumpy about it, but they pay their premium because the insurance company says, we're going to send it to collections. If they do pay their premium, they might be eligible for APTC for that month. So just because someone doesn't want to enroll in their plan anymore doesn't mean that they wouldn't be APTC or PTC eligible on their tax return. So it's possible that someone could still get financial assistance at the end of the year when they file their taxes for that month if they were eligible at the time. But of course, to do that, they'd have to have paid their premium by the deadline, by the tax filing deadline. So, and there's a whole realm. I guess we'll use this time to do a plug. We haven't scheduled it yet, but there's just this whole realm of reconciliation issues. And right after open enrollment, I think, or maybe during open enrollment, but y'all can listen to it afterwards. We usually do a webinar that is geared toward tax preparers, but it has a lot of useful information for enrollment assisters if you're helping people after January 1st when people start getting their notices, their 1095As. So look out for that webinar that'll be available and online posted like the rest of our webinars. So that was my little segue, a little promotion for for the tax prep side of all of this financial assistance.
Great. And the next question is, if an individual makes significantly less this year than they estimated, and when they go to reconcile their taxes for 2020, they're actually ineligible for a tax credit because their income is too low, will they have to pay those tax credits back?
That's a great question. And the answer is no. So if we're talking about filing for 2020, and let's put numbers on it to make it a little easier. So let's say that someone projected their income at $25,000 for 2020. But then, you know, there was a pandemic, there was a recession, there was, you know, all of this 2020-ness. And their income actually dropped down to $10,000. So if that was the case, then when they went to file their income taxes, they would find that their income was below the poverty line. So you would think that they would not be eligible to claim PTC and that they might have to pay their APTC back. But that's not actually the case. There's a tax rule that saves them and that says, if the marketplace said you were eligible based on projected income, then we're going to consider you eligible. And so you're still going to get your APTC even though your income was below the poverty line, because, you know, the marketplace kind of made a promise to you. You followed the rules at the beginning, you made a legitimate projection, the marketplace, you know, does their income DMIs or whatever, and so it was considered verified. And so if things happen during the year and you end up with income below the poverty line, it is going to be okay, you're not going to have to repay.
And what is some practical advice to help consumers who say, I just can't estimate income for 2021? Will the marketplace accept a 2020 tax return or 2019 tax return as proof of income?
So I'll take those as two separate questions. So remember when you're justifying, so let's say you apply to the marketplace. And you're trying to get through the application, you're trying to figure out what your 2021 income is, you're basically making guesstimates, right? You're making a guesstimate about your unemployment income because you know that unemployment insurance, the federal benefits end December 31st. Your state benefits might continue for a little while, but those might end if you've been on UI for, you know, a significant part of 2020, you might cap out on weeks, and you might anticipate getting another job. And maybe you work part-time and you'd like to work full-time. There are just all sorts of variables. So you've just got to do your best at the beginning. And what I'm telling people this year is this is really a time, if you haven't been doing it, this is a great time to make sure that people walk away with paper. Walk away with paper that says not just what their total projected income is, what their projected annual income is, but all of the different components of that. Because to the extent that people have several different, you know, multiple jobs, plus unemployment, plus maybe other types of income, the more you're guessing, the harder it is to keep track later in the year to what you said. And so it will be important for people to be able to do that tracking and have a little more information to be able to do that. So that's my recommendation for estimating income. There's really, you know, none of us have a crystal ball. The best recommendation, I think, is to have people report changes. For the question of can you use, like, how do you justify then your income guess? 2019 tax return only gets you so far, because remember, you're trying to justify 2021. And so to the extent that your 2019 tax return might be very different, that's not going to help you get to 2021. The kinds of things that they're going to look for if you have an income DMI is, you know, W-2s that reflect 2021 income, and other kinds of, I'm sorry, not W-2s, I mean pay stubs. or different kinds of income receipts. If you are anticipating self-employment income, they would want to know about that and what your anticipated income and expenses are. So remember, the key is that you're justifying 2021 income. And so going back in time may not help you, especially this year. But remember that you can also, and we covered this when in the webinar on DMIs, but you can also submit some kind of letter that says, my income is very different this year, and here's why. I anticipate to get this much from a job, anticipate getting this much from a second job, and this much unemployment. And you can just kind of lay out your scenario and why things are different. I lost my job last year. This is going to be a common thread, right? So expect more income DMIs. Expect to help folks write letters to explain differences in income. But there's really not going to be a lot of magic to any of this. We're all going to be kind of struggling to figure it out.
Thank you, Tara, for that. So we can take a couple more questions. If an individual receives unemployment and this results in their income increasing for the year, but they don't report that change during the year, how will this affect them?
So is the question if people don't report a change during the year? Sorry, you cut out for a minute.
Oh, sorry about that. Yes, that is the correct question.
So if people don't report an income change, there are a variety of consequences. So if people have a dip in income in many states, most states, people could potentially qualify for Medicaid. And if they have income that's too high to qualify for Medicaid, they could qualify for a higher APTC to make the premium burden less during the year. So that would be a great time to report. Really beneficial. And if people see an income increase, obviously it's important to report it because you want to avoid reconciliation at the end of the year, or you want to avoid repayment rather at the end of the year. And so if your income goes up, you may be getting too much APTC, and it's helpful to tell the marketplace as soon as possible so you can scale that back and not have to repay so much at the end of the year.
Great. And we had a couple of non-renewal questions, but questions related to the reconciliation.
Okay.
Let's see, I'm just going to scroll through them really quickly. So can you talk a little bit more about repayment? There are a couple of questions that came in about individuals who estimate their income lower than what their income actually ends up being due to unemployment benefits, and the penalty that they'll have to pay back the tax credits.
Yeah, so that might be a real problem for some people this year, unless Congress does something that changes the reconciliation caps due to COVID craziness. So if someone, let's put numbers on it again, if someone estimated their income at $20,000 because they were working part-time or working full-time, and estimated 2020 income at $20,000, but then they lost their job, but they got that income bump from the federal unemployment insurance. So that $600 a week really helped people get through some very tough times when they lost a job and lost their income. But it also, in some cases, actually increased someone's income versus what they would have received for the same months had they been working. And so that could be a substantial income increase for some people who received the whole, especially if they received the whole course of the $600 a week, which lasted until the end of July. So people could have so this person who had an estimate of income at $20,000 could find that he ended up with income at $30,000. And so if he was getting APTC for that lower projected income and then has a higher projected income, he's going to owe back a portion of that APTC. And we know that repayment can be quite steep. And I haven't done let me look at my handy sheet here. The repayment caps for 2020 have gone up a little bit. So someone who has income below 200% of the poverty line could, if they're single, could owe $325 and double that for any other kind of taxpayer. But people who have income above 300% of the poverty line and below 400% could have a repayment of up to $2,700. $2,700 is pretty steep. And of course, if someone ends up with income above 400% of the poverty line, there's no saving them. They owe back every dollar of that APTC. So it'll be particularly important for people who have income that is going to be close to 400% or just over 400% to stop the APTC as soon as they can.
Great, thank you again, Tara. So as a reminder, we'll be distributing the materials from today's session via email. We'll post everything to the Beyond the Basics website at www.healthreformbeyondthebasics.org. The next part of this webinar series is scheduled for next Thursday, October 15th, 2 p.m. Eastern, 11 a.m. Pacific, during which we will delve into special topics that impact immigrants and their families, including an update on public charge. You can register for upcoming webinars on the Beyond the Basics website. You can also find additional resources on that website, including reference charts, guides, and frequently asked questions. If you have any questions or need assistance, please email our Beyond the Basics contact email at beyondthebasics@cbpp.org. And with that, we'll bring today's webinar to a close. Thank you all again for joining us today.